Good afternoon. I'm Jeff Flax, the President and CEO of Hartford Healthcare. Thank you for joining us here today. Today's a great day, and it's another day of great progress within our state and certainly within our healthcare system. We're delighted to be inaugurating today the Xfinity Center as the 6th mega center for Hartford Healthcare. And today we'll be vaccinating teachers from throughout the state. And I'm so proud that over the next 3 days, Friday, Saturday, and Sunday, we will vaccinate on this location 2,500 teachers across Connecticut as we continue to make our commitment to return all of our kids across the state to the classroom and to help protect our teachers. On Monday in this center, we will be doing 1,100 vaccines that we will be providing through a partnership with the United Way as we work to develop alignment and deeper commitments within our community, where we will be using the 211 local system to bring immediate community members here in Hartford, the north end of Hartford, into this center to be vaccinated. Across our health system today, we've already done over 150,000 vaccines, and it is making a tremendous difference. When you look at our health system alone, in our nursing homes, just months ago, where we would see 40 and 50 residents and a number of our staff have COVID-19, today we have 0 residents with COVID-19. It's making a tremendous difference. Look at our hospitalization rates. Our hospitalization rates across Hartford Healthcare and across the state have fallen in half over the last 4 weeks. When we look at the people we test across the whole state of Connecticut, our testing rates have also fallen in half over the last 4 weeks. So we are making great progress, and we are continuing to turn the corner. It is essential that in this moment we continue to be vigilant, that we continue to practice safe hygiene, safe distancing, that we continue to wear masks, because we are making a true turn here in the state. And as we vaccinate people and centers like this continue to come online, we are creating tremendous capacity. Our health system this next week will vaccinate about 15,000 people next week across Hartford Healthcare. We're built to vaccinate 80,000 people today in Hartford Healthcare, and we can scale beyond that. Our commitment within Hartford Healthcare is we will leave no community behind. We have mobile vaccination centers going out twice a day across the state of Connecticut, vaccinating thousands of people, bringing the vaccine to where people are. We're also using centers like this with massive infrastructure and parking to invite people here to be vaccinated, and at the same time, we're bringing people through transportation to centers like this. Our only rate-limiting factor is the amount of vaccine we get. We will continue to build and scale up our operations, use all of our capabilities, use all of our resources and ingenuity to ensure that we can get as much vaccine as quickly as we can to the residents of the state of Connecticut. We just need to work with our government at the state and federal levels to continue to bring as much vaccine as we can here to this state. It's my pleasure to welcome several people who have been tremendous partners, advocates, and supporters of bringing testing and vaccination centers to all of our communities across the state. And the Lieutenant Governor, Susan Bisowitz, has been a tremendous ally throughout this process. She calls frequently, asking for ways to help support our efforts to bring vaccine to the entire community, and particularly to people who are most vulnerable. It's my pleasure to welcome the Lieutenant Governor for the state of Connecticut, Susan Bisowitz.
Jeff, thank you so much for your leadership. It's because of the very strong partnerships that we've built with Hartford Healthcare, our hospital systems, and our community health centers that we are one of the top tested states in the country and one of the top 5 best vaccinated states in the country. I'm very happy to tell you that we've surpassed more than 1 million vaccine doses given out in our state. 75% of our population over 75 has been vaccinated. 52% of our population between 65 and 74 are vaccinated. And now individuals over 55 have started to make more than 100,000, 150,000 appointments for their vaccination, and among them are, among one of those is my husband, who this morning, after trying since March 1st, was able to make his appointments at CVS, one for Sunday, and then his second appointment April 4th. So he is one happy camper today, let me tell you. I am thrilled to be here today, Jeff, to see what you're doing on two fronts. One, to help vaccinate the thousands of teachers that we have in our state who are helping to keep our schools open. And yesterday, the governor and I celebrated Miguel Cardona's confirmation as our education secretary at the federal level. And Jill Biden, our First Lady, came to see Connecticut because she wanted to see how it is that we've been able to keep so many of our schools open across our state. And the way we've been able to do that is by vaccinating. And we're going to continue to do that by making sure that our teachers, who are a priority target now, are vaccinated. Randy Weingarten and Jan Hockadell, our national and state leader of the AFT, the teachers unions, came also because they know that vaccinating teachers is a priority for us here in Connecticut and also for President Biden. So we are very excited to see how you are building out this vaccination capability, because President Biden is going to make sure that we have millions of doses available sooner rather than later, which is exciting because here in Connecticut, on March 22nd, we're going to start vaccinating people 45 and up, April 12th, the 35 and up age group, and May 3rd, 16 to 34. So we are so excited to see this infrastructure being built, and we appreciate Hartford Healthcare's attention to equity. The governor and I want to make sure that every resident in our state who wants a vaccination gets vaccinated, and we are really going to have to pay attention to and work hard to make sure that everyone has access. And so one of the ways we're going to do that is going where people are with mobile units, making sure that people who need a vaccination can get a ride, and they can do that if they call 211. And we're going to be building out vaccination operations in every community, especially vulnerable ones. So, Jeff, I want to thank you for your incredible leadership, and I want to thank everyone of our healthcare workers who are helping today to make this happen. We've had thousands of people step forward who said they want to help, and they volunteered. So retired nurses and healthcare professionals and people who just want to help in this important effort have come forward, and we thank you for and them for your generosity with your time and your talents. So thank you so much, Jeff. Happy to be here to support this great operation. Thank you.
Thank you, Lieutenant Governor. We're very grateful for your support. In Hartford Healthcare, we've said we will ensure that no community is left behind. And I can ensure in saying this that there is no person who's been more committed to that, who's working more tirelessly than the mayor for the city of Hartford, Luke Bronin. And Luke has been a constant figure, creating tension, working hard to push all people throughout this region to create as much capability, as much access as we can for vaccine. And that's why centers like this get created. And it's our pleasure to welcome the mayor for the city of Hartford, Luke Bronin.
Thank you so much, Jeff, and thank you to the entire team at Hartford Healthcare. Hartford Healthcare has been just an extraordinary partner from day one of this pandemic, treating those who have the virus, saving lives, getting tests out into the community, and making sure that we battled the virus with the best tools we had then, which was testing and prevention, and now the largest provider of vaccinations throughout the state, providing thousands of vaccinations here in the city of Hartford, both at the convention center and now at this site right here at the Xfinity Theater. I'm going to talk a little bit more about how much it means to have those. Jimmy, that's for you to explain. I'm going to talk a little bit more about what it means to have these mass vaccination sites where Hartford Healthcare can vaccinate 1,000 people a day here and also at the convention center. But I first just want to take a minute to also say a huge thank you to Hartford Healthcare for the work that they're doing to get the vaccines out into the community and also to conduct outreach. Hartford Healthcare has been working with our health department and in our community to provide mobile testing, and now they're also working with us to provide mobile vaccinations, bringing vaccines to apartment buildings, to senior centers, to homeless shelters. It's been such a critical part of the vaccination effort, and I want to make sure that part gets just as much focus as these large sites, because it's a huge part of combating the disparities that we have to acknowledge exists here, just like we're seeing around the country. The other piece, which I was talking with Keith Grant about just before we started, is that just like our health department here in Hartford is proactively making calls into the community and knocking on doors, Hartford Healthcare team is doing that same thing. They called 1,000 folks, I think it was yesterday, you said. That makes a huge difference too, because a critical part of getting all of our communities vaccinated is not just access, but it's education. People have lots of questions. They're legitimate questions. We need to make sure that we are proactively reaching out to everybody, answering those questions, and making sure that everybody knows, A, what the vaccine is, what it does, why you need it, and how you can get it. And so every piece of that effort, from the mobile testing to the outreach to sites like this, is something that Hartford Healthcare has embraced, and I just cannot say a big enough thank you. Now, at this site, because of the amount of team resources that Hartford Healthcare has committed, because of the scale and the logistics of it, you can vaccinate 1,000 people a day here. Again, that's on top of the 1,000 people at the convention center, but it can also be even bigger than that when the supply expands. And on that point, I just want to say thank you to Lieutenant Governor and to the Governor and the entire team there, Josh Jabal, Michelle Gilman, Deidre Gifford, everybody who's been a phenomenal partner in trying to get the vaccine supply expanded, trying to get as much predictability as possible, and working with all the partners in the system on a daily basis to make sure everybody is able to do as much as they are capable of doing. So thank you, Lieutenant Governor, for the entire administration's efforts and partnership. And now lastly, let me just say a huge thank you to Xfinity Theater and to Jimmy Koplik, who runs the Xfinity Theater, created Xfinity Theater as the heart and soul of this place, along with all the team that he leads. But he stepped up without hesitation a few months back and said, let's make the Xfinity Theater a site for mass testing. And at that time, he said, can we do the same thing for vaccination? And that was months ago, that was many months ago. That was before we knew what was going to be possible, what the timing was, anything. But he was already saying, we're doing testing here, let's make sure we get ready to do vaccinations here. And that is what we're able to do now, because you have not just said yes, but you said from the start, let's be sure we do it, and let's sure we're ready to do it as quickly as we can. So Jimmy, thank you to you and the whole team. And obviously, I'm hopeful that it's not too long from now that we can be back here, not just for testing or for vaccinations, but to see some great concerts. I'm sure you're hopeful about that too, Jimmy. But given the president's announcement yesterday about the pace of vaccine availability, given the work that all of our partners are doing to make sure we get that vaccine out into our community, and given the fact that our state has been a leader around the country in getting our residents vaccinated, I'm confident that we'll be able to be here and see some good music soon. So again, a big thank you to everybody. And I know in the room right now, we've got a bunch of teachers and school resource officers and others from around the state. And I just want to say thank you to all of you as well for what you do. And we're also so glad that we're able now to get you protected because you haven't stopped doing the vital work that you do all year long. So thank you to everybody, and Jeff, thanks again to you and your team.
Thank you, Mayor Bronin. Mayor Bronin is a tremendous problem solver, and we're so grateful for that as we work through addressing unprecedented moments. Yesterday, within Hartford Healthcare, we received 7,400 doses of the J&J vaccine. Another great step forward for the fight against COVID-19. We were amongst the first places in the country to administer that vaccine. We're very proud of that. I'd like to invite our Senior Director of Infectious Diseases, Keith Grant, who has been his effort and his focus on the front line and protecting all of our colleagues at Hartford Healthcare and serving our community has really been beyond description. Thank you, Keith.
Hi guys, it's always really hard following this group, especially Jeff, right? Like all the cool stuff's already been said, right? But seriously, when this started, one of the most challenging things that we found was how do we spread information? How do we ensure that the appropriate information is going out? So Rebecca and her team, every time I get up, I thank you guys. Every time something comes out, every time a vaccine comes out, a new process, CDC has an update, we're able to communicate with the team. Where vaccination is concerned, I just spoke to Spencer about the amount of, so Spencer is our pharmacy guy that stays in the background, but the amount of work that his team constantly put in to ensure that we have and this logistically goes the right way. So I just want to thank these guys so much. And then from a background perspective, I know Jeff is in the front a lot, but there's so much that happens that he ensured that happens in the background. It's almost like an iceberg. Like what you guys see up front is like just a tiny bit of how much effort he puts in to ensure that this happens. So we really do genuinely appreciate that. And then from a community perspective, so one of the things that we do know is in order for Connecticut to be, at this point, experiencing a 2.23 prevalence rate in a time of great impact by the pandemic, there has to be great collaboration from everyone. So every single person in regards to proper PPE, respecting social distancing, and the effort from our state and local government to ensure that we're having the resources that we need. So, I can't start or finish anything without thanking our entire population within Connecticut. We've done a really good job. So now we have 3 vaccines, so 3 different vaccines, theoretically 2 different vaccines, so 2 different processes. So some of the questions that I've been getting is which vaccine is best? So I think Dr. Fauci puts it best. I don't know if we all always agree with him. I certainly have. The best vaccine is the available vaccine at this point. And if you look at the vaccine trials, when the Pfizer and Moderna vaccine came out, one of the primary questions was, is it safe and is it effective? If you look at the trials from the vaccine, and of the 60+ million people who have gotten the vaccines, still very consistent, still a very safe vaccine as proven by not just the trials, but individuals who's gotten it, and still very effective as proven by a 90% national dip in mortality rate in SNFs or nursing homes. That's pretty significant. In an area where we had high mortality of upward in some areas of 60+%, we've managed to reduce that by over 90% nationally. So it's pretty significant, primarily because of the vaccine. We've seen significant community impact. We're seeing a significant shift in belief and hope. We're starting to have conversations about planning for events, in August, September, like, is it possible for us to have outdoor events or put stuff together? And my answer now is, we can start planning for it, plan for the worst, just in case we're not able to do it, but I'm able to say that right now. So epidemiologically, so the numbers look good, but I think most importantly, it shows that we're collaborating well as a state, and I'm significantly proud to be a part of it. So everyone that works in the background, Jeff, thank you so much for putting this together constantly. Definitely appreciate it, but also every single person within the state for putting their effort in place to ensure that this is happening. Last thing I'll talk about. So our approach to these vaccines, we had a huge conversation about it. Should it be a choice? So when you go on and you decide to choose a vaccine or decide to choose to get the vaccine, should I be able to choose between the mRNA vaccines or the Johnson & Johnson vaccines? You know, one of the concepts that I respected with Hartford Healthcare, even before I joined Hartford Healthcare, is how accessible this is. So you have a choice as to how you get care, where you get care. I think the data is within 15 miles of every person in Connecticut, there's access, so you do have a choice. So it is within the values of Hartford Healthcare to ensure that individuals have a choice. So when you do register at Hartford Healthcare, you will get to choose which vaccine you get administered. And again, my theory on this is all the vaccines and all the trials, all the vaccines prevent critical illness and prevents death. And that's where we want to get back to. A normal disease process, easier to manage. Preventing disease, preventing death, right? That's all I have. Jeff?
Thank you, Keith, for your leadership. It's been absolutely phenomenal. And I want to recognize, as Keith said, the entire team, the village of people who work within our health system who make this possible. The effort to do this is critical, and we are really making tremendous progress. Last week, we were in Bridgeport a week ago this past Monday, and we were inaugurating the Hartford Healthcare Amphitheater. And it was a great moment for us, and this is an extension of our partnership with Live Nation. And Jimmy Koplik from Live Nation is channeling all of their resources in this moment to restart, reignite kind of life as we know it in Connecticut. And we're enormously grateful. We have a wonderful partnership at the Oakdale in Wallingford, which is also a major testing site now, as well as here in the Xfinity Center. And Jimmy, your willingness to work with us and use all of your resources to fight this pandemic has been absolutely essential. And we're really grateful for your leadership and your citizenship. Jimmy Koplik.
Native, it goes on and on, KISS, and we can look at the names that have really been here. And when I built this place in 1995, that's all I thought I'd ever have here. I never thought I'd come into my lobby and I'd see testing centers and vaccination centers. So, you know, when you think you've seen everything, you really haven't seen everything. But the one big surprise to me, which evidently really shouldn't be a surprise because I have been vaccinated, I'm of that age, I'm over 70 now, and is the enjoyment that the person has when they leave getting vaccinated. I'm used to being up here and seeing the enjoyment people have when they leave seeing a great concert. Well, it doesn't beat the enjoyment of getting vaccinated, I can tell you that. And I'm living proof because I've been to tons of great concerts, and I'll take the vaccination enjoyment over the great concert enjoyment. That's for sure. So I do want to also always thank Jeff Flax. He's a tremendous partner, a unique partner, Hartford Healthcare, Rebecca, the whole team. It's quite extraordinary how quickly everything's been able to be done in the vaccination area of our business now. I feel like I'm in the vaccination business. And I also, of course, want to thank the Lieutenant Governor and my good friend, the Mayor, who Mayor's a great landlord and a great friend, and the entire state administration. We should all be proud of ourselves in Connecticut. We're masking, we're testing, and we're vaccinating. And as I've always said, I'm so proud to be a citizen of Connecticut, and it's because of these people here that really makes me proud. Thank you very much.
Thank you. Our team would be pleased to answer any questions you may have.
There was obviously a lot of conversation about the supply of doses. Do we have any idea when we'll start to see a significant supply increase here in Connecticut? And what can you say to people who've been making appointments this week who are finding they're going to wait until June or July?
Well, first of all, we're just thrilled that the president has made getting hundreds of thousands of vaccinations out to the state, a very top priority. I have witnessed firsthand what it's like for those in the 55 to 64-year-old age group try to make appointments, because my husband, as I mentioned before, has been frustrated since March 1st, where he was going online, but he just kept at it and was able to make an appointment this morning. What I tell my constituents, because no surprise, Mayor, your constituents are probably the same, top questions are about how and where can I get a vaccine. So I tell people, call 211 to make an appointment over the telephone, or talk to your public health department or to your senior center, because at the local level, a lot of health departments are arranging their own clinics, and they're keeping spreadsheets of people who want to get the vaccine. So if you're one of those who's frustrated, it's been difficult to go online, please call 211, call your senior center, call your local public health department, because you will get access and you'll get more information about clinics that might be held in your area. Also, Walmart, CVS, and Walgreens have lots of appointments, and that's how my husband was able to get his, because a lot of those pharmacies are now making appointments for people. And it's funny, today I got a call from my CVS about making an appointment. And hospital systems and community health centers are reaching out to people who have visited their facility or one of their clients or patients, and they've been helping people to make appointments as well. So I don't know if anybody else wants to add anything.
Yeah, I mean, you know, the process of getting appointments have become way more efficient, but there's still significant room. There's still significant opportunity, obviously. We're getting to a point where the more tiers are added, so the more, you know, we move from just healthcare professional or providers, and we keep adding people, so more people are calling. So it's almost a good problem to have, but at the same time, we're putting more effort into it, more resources and more initiatives into it to ensure that it's more efficient. So I agree with Lieutenant Governor, keep trying, but it will get significantly easier very, very, very soon. So there's a few things that we're working on that's gonna help to complement the process significantly, very, very soon.
Amazing educators here, and we're going to kick it off with Kristen Abbott, who is a preschool teacher. They're eager to, so she was just going to tell us a little bit about why she's getting vaccinated and what it means to her. Actually, if we were going to have all of our, and anybody who would like to talk about being vaccinated, you don't have to get a lot of votes, but Kristen gets to kick it off. I know you're eager.
I am eager. My name is Chris. I'm a little nervous. My name is Kristen Abbott. I work in West Hartford at NJCC preschool. I'm very excited to get my vaccine because, you know, it's the kids. It's about the kids, and I want to be healthy for them. I'm also excited to get it because I haven't seen my sister really in person for very long, in months and months and months, and she's moving away to Arizona, and I'm thrilled to get it so I can at least see her and my niece before they leave in a few months. And it's just, and I also be with my mom, who I don't get to visit very often because they're older, and I want to be healthy for them. And they actually just got their first vaccine last week. So, yeah.
Thank you.
My name's Ed Pond. I'm a teacher at the Loomis Chafee School here in Windsor, Connecticut.
And it's just really, really impressive to see this site come together and start offering the vaccines so quickly and in such great quantity. Now it's our job as individuals to get out here and make sure that we take advantage of these opportunities and get vaccinated as quickly as possible so that we can take care of our state and our country. Thank you.
Good afternoon, everybody. My name is Hector Dones, Hectordones. Just want to express I'm very grateful to be here and given the opportunity to be vaccinated today. I can take care of myself, my family, and my coworkers. I'm very grateful for that. Thank you.
Nicely done.
Hi, my name is Deborah Piotrowski, and I work at Environmental Sciences Magnet School at Mary Hooker. First, I want to say that I'm very proud to be a Hartford Public Schools teacher. We've been back at school since August, and this next layer of protection for us, I very much appreciate it. Thank you.
Thank you. Nicely done.
Hi, I'm Felicia Kroll from Enfield Montessori School, Kroll, C-R-O-A-L. And I'm excited to be here today to get my vaccine. It's nice that teachers have become a priority because we see the children as our priority. So now, for me, it's being able to go to school with a little more hope and a little less fear of the unknown. So, yeah, I'm excited to get this done. Thank you.
Hi everybody, my name is Molly Pond. I'm also at the Loomis Chafee School, and I moved into a new role this year as the Director of Online Learning for our school. And I can tell you for our students, over 100 students who have been online since last March, being able to get the teachers vaccinated so more and more of those students can come back to school and be in the classroom full-time is just an incredible opportunity. So I thank you all for everything that you've done, especially you, sir, for opening the center and making this a space where more and more vaccinations can happen.
My name is Catherine Russell. I'm a proud teacher at the Caravali Academy, the new middle school at the Enfield Montessori School in Enfield. I am super excited to be here today. I want to be able to see my kids' faces, my students' faces on a daily basis, and I want to be able to see them work together in a group without having to worry about being 6 feet or 3 feet away. We used to walk around with pool noodles saying you need to be this far apart because we've been in school since September, face to face every day. The kids are so resilient, but I'm tired of seeing the fear in their eyes. I'm tired of feeling the fear of bringing this home to my family. I live with an 83-year-old mother and a compromised 61-year-old brother who I take care of. They've received their first vaccinations already. So for me to be getting this, I am super excited. I am ready to roll up my sleeve because I really think this is the fastest way, the quickest way we can get back to normal here in the state of Connecticut.
borrow your goggles or the bottom? The capture thing for the.
Who doesn't have his IFB with him?
Yeah, I don't have it with me.
Okay. You don't have the little adapter deal?
No.
Okay.
Oh, you ready?
You'll just look at me and we're not live.
Okay.
All right. First, can you spell your name for me?
Crispin, C-R-I-S as in Sam, P as in Peter, I-N as in Nancy.
Last name?
Abbott, A-B-B-O-T.
And remind me where you work.
I work at the Mandel JCC in the Early Childhood Center.
Okay. So, how do you feel? You just got the shot. How do you feel?
How do I feel? I feel great. I feel no soreness, no nothing.
And talk to me about. Obviously, they have educators here today. You're going to be doing educators all through the weekend. I mean, as somebody, as an educator, how does it feel to have this?
It feels great. I'm staying healthy for the kids, and that's it. I'm staying healthy for the kids.
And talk to me about what it's like working in an environment like that, working with kids during the pandemic.
It's different. The kids I work with are 3 and 4 year olds, so they do wear masks all day, except when they go outside, they can take them off. But they realize that they have to put them on, and we do have to explain sometimes that we have to wear the masks so we stay healthy. And they seem to get it as much as a 3 or 4 year old.
Right, of course. Obviously, they can only understand so much about what's going on around them. So I'm guessing there's a real desire to have things return to normal once everyone gets vaccinated and have them be kids.
Absolutely.
Sorry. I'll ask that again. I'm sure there's a real desire to have things get back to normal and to let them be kids again.
Yes, because you know what? They can only be kids so much with playing with the mask on, and just they need to